Hello, everyone. My name is Olivia DeCurtis, and in this presentation, myself and Legacy Delgado will discuss inefficiencies in the surgical throughput process at Hipkins Hospital. Compared to other outpatient surgical centers, Hipkins Hospital is operating below national standards. Through a comprehensive analysis, we will compare the initial operating model to a proposed optimization solution, identifying key bottlenecks. Simulation analysis will assess if there is a beneficial impact to implementing the proposed optimization solution. Limited staffing and unbalanced resource allocation have led to inefficient surgical throughput processes at Hipkins Hospital. In the current model, severe bottlenecks lie within inefficient registration processes along with patient flow times. An anesthesia imbalance exists with a 97% provider overutilization rate and hindering surgical throughput, resulting in suboptimal patient flow times of 199 minute in track A and 198 minute in track B, respectively. An overutilization in anesthesiologists contributes to provider burnout and may lead to adverse patient safety events, such as unintentional harm or even death. In this case, optimization allows for redistributed resource allocation, increasing parallel efficacy to reduce patient flow times on average by 18%. This rebalance in provider workload improves cases per day, leading to increased profitability. This optimization process provides an overall process improvement in operating efficiency, improving both the provider's and patient's experience.
The Department of Orthopedic Surgery at Hipkins Hospital offers patients total hip or total knee arthroplasties. According to the American Joint Replacement Registry, the demand for total hip and total knee arthroplasties continues to rise. In 2024, 4.3 million total hip and total knee procedures were captured, indicating a nearly 300% increase since 2021. To meet growing national demand, Hipkins Hospital must ensure optimal surgical throughput while simultaneously balancing the triple bottom line. Currently, Hipkins Hospital has two tracks, A and B. Each of the two surgical teams is allocated two dedicated operating rooms, one orthopedic surgeon, and one anesthesiologist. This results in a combined unit capacity of 4 ORs, 2 surgeons, and 2 anesthesiologists. Furthermore, the unit is supported by a shared staff pool consisting of 2 registrars and 2 EVS members. Each day, about 7 patients are scheduled for surgery. However, with current workflows, patients are being bumped to the next day, creating patient dissatisfaction. Failure to improve operations at Hipkins Hospital in the Department of Orthopedic Surgery will have negative impacts on provider well-being, patient well-being, and ultimately the financial performance. To pinpoint operational inefficiencies and identify improvement opportunities at Hipkins, an in-depth analysis of current processes was conducted. 5 simulations were performed and a 95% confidence interval was applied to account for the inherent variability within the healthcare environment. The analysis revealed the following operational metrics. The average patient flow time for track A was 200 plus or minus 24 minutes. The average patient flow time for track B was 198 plus or minus 9 minutes. The average daily surgeries for both track A and B was 4.4 plus or minus 0.5 cases. While the simulation yielded an average of 4.4 surgeries, the actual daily throughput must be rounded to a practical limit of 4 to 5 completed cases. The similar flow time suggests process parity between tracks, but the wide confidence interval for track A's flow time indicates high process instability compared to track B. With an industry benchmark reaching 12 orthopedic surgeries per day for specialized centers, the current operational practices do not maximize potential earnings, yielding an average profit of only $28.45 million. Optimal resource management requires that healthcare professional utilization be critically balanced to mitigate negative impacts on staff, patient outcomes, and fiscal health. A utilization rate consistently above 90% is unsustainable and poses a major risk. Specifically, Hipkins is facing a severe operational constraint, chronic overutilization of anesthesiologists. The simulation data confirms the bottleneck, showing a uniform 97% utilization rate for anesthesiologists across both Track A and B, indicating systemic inefficiencies and operational stressors. A core tenet to the triple bottom line is the people pillar, and Hipkins' operational inefficiencies are directly compromising this commitment with consequences on both patients and staff. Poor resource allocation generates long patient wait times, which leads to frustration, anxiety, and ultimately decreased patient satisfaction. Simultaneously, this operational stress contributes to high rates of physician burnout. This is a severe threat given that 50% of orthopedic surgeons and 67% of anesthesiologists surveyed report high risk or incidence of burnout. This level of staff burnout directly increases the risk of medical errors and harm to patients, undermining the quality and safety of care. Ultimately, these core operational and human resource failures are restricting Hipkins' potential for high profit maximization and a positive high performance culture. Our recommended strategy for operational improvement at Hipkins involves two key changes: integrating mid-level providers, such as certified registered nurse anesthetists and physician assistants, and implementing a pooled staffing model for applicable clinical staff to increase team agility and reduce reliance on single resources. The validation of these changes was conducted using an optimization tool, a digital twin, across 5 simulation runs with results measured by a 95% confidence interval. The analysis confirms a strong positive return in efficiency gains, capacity expansion, and increased financial impact. The average patient flow time for Track A was decreased to 160 plus or minus 15 minutes. The average patient flow time for Track B was decreased to 166 plus or minus 20 minutes. The average daily surgeries for both Track A and B was increased to 5.6 plus or minus 0.5 cases. Again, while the simulation yielded an average of 5.6 surgeries, the real-life daily throughput must be rounded to a practical limit of 5 to 6 completed cases. These combined efficiencies boost average profit to $40.24 million, achieving an increase that is almost double the current profit margin. Simultaneously, the core bottleneck is resolved. Anesthesiologist utilization is sharply reduced from a detrimental 97% to a sustainable average of 69%. Despite minor limitations inherent in using a digital twin, the significant operational gains validates its use for making robust business decisions. Implementing this model achieves a true triple bottom line benefit. Workflow efficiency is maximized, leading directly to increased surgical cases and greater competitive advantage. Decreased perceived patient wait times will increase patient satisfaction and reduce negative emotions. Finally, reduced provider overutilization and burnout will lead to high-quality patient outcomes and a safer, more positive surgical culture.
While this optimization model improved bottlenecks in anesthesia utilization, patient flow rates, and overall operating capacity compared to its original model, it wasn't a perfect solution. Optimized staffing through the elimination of 1 registrar role, addition of 2 CRNAs, and an additional pooled staffing approach resulted in notable improvements across surgical tracks A and B. Staffing rearrangement in this optimization model allowed for an optimal patient flow times between 160 minutes plus or minus 15 in Track A and 166 in Track B. As a result, the operating system achieved a 17.9% reduction in average flow time, from a monetary improvement of $3.5 million overall in profit gains. A redefined staffing model achieved workload stability, allowing physicians to operate on a balanced, sustainable operation, averaging on 5 to 6 surgeries per day, decreasing the risk of physician burnout by 28%. Improved flow efficiency, along with a reduction in variability, improved overall processes at Hipkins Hospital by reducing key bottlenecks. This resilient staffing model demonstrates an initial optimization plan to improve throughput operations. It serves as a foundation for paving Hipkins Hospital's long-term sustainable path to success.